Good morning to all. And, myself, Mikin James, designation nursing tutor, Dinsapredel College of Nursing, Nadiad. Today, we will discuss about the topic of urethra in the medical surgical nursing. Okay, this is the part of the urethra. This is the first picture. We can see the female urethra, and next we can see a picture of the male urethra. In the female urethra, that it is the mainly two part. Distal urethra and proximal urethra. Distal urethra is also known as the anterior urethra, and proximal urethra it also known as the posterior urethra. In the male and female, we can see the both same are the distal urethra and the proximal urethra. So it is the picture about the female urethra and male urethra, distal and proximal urethral part of the both female and male. Next, first of all, introduction about the urethra, a tubular structure emerging from the neck of the bladder and opens to the exterior. Okay, next, it is the outlet of bladder and eliminates urine to outside. It is also known as the functions of the urethra. Okay, outlet of the bladder and eliminates urine to the outside from the body. It is the function of urethra. And next, prevent in both male and female, but there are some differences between two. Okay, next difference is about the male urethra and female urethra. In the first of all, male urethra, in that first male urethra, it is the long, and the second length about the male urethra, it is the 18 to 20 centimeter long, and third function, mainly function in the male urethra, it is the urination, and also function the ejaculation of the semen in the male. Okay, next four, course, it means course covered. Next, it extend from internal urethral orifice to external urethral orifice. Okay, it is about the male urethra, male urethral difference. Okay, next, female urethra. Female urethra, it is the short length about 4 centimeter and diameter is 6 mm. Okay, next, functions of the male urethra, only urination. Fourth, it is a course nearly straight. It is the straight. Okay, in the male urethra, it is the covered. Okay, curve, and in the course of the male urethra, female urethra, it is the nearly straight. Okay, fifth, folic catheterization is easily. Okay, next, parts of the urethra. It has mainly two part of the urethra. It is common in the male and female. Okay, next, first, it is the anterior urethra. It also known as the distal urethra. Second, the posterior urethra, also known as the proximal urethra. Okay, it is the picture about the urethral parts of the urethra. First of all, we will see anterior urethra. This is the anterior urethra, and this is the posterior. This is the posterior urethra in the behind to anterior urethra. Anterior urethra, it also known as the distal urethra, and posterior urethra also known as the proximal urethra. Okay, this is the picture about the parts of the urethra. Okay, next, first of all, anterior urethra, also known as the distal urethra. In that first, A, 16 centimeter long, and B, lies in the perineum and penis. Anterior urethra, it has other two parts. First of all, bulbal urethra, and second, penile urethra. In the bulbal urethra, which is situated in the bulb of the penis. Okay, so it is the bulb of the penis. Bulb of the penis, which can be situated to the bulbal urethra. And next, penile urethra. So it is the situated in the body of the penis. Okay, it is the penile urethra. It is all about the anterior urethra or the distal urethra. Okay, next, posterior urethra, also known as the proximal urethra. It is the near to the bladder, 4 centimeter in length, and lies in the pelvis. Okay, next, it has any main three part. Posterior urethra, first of all, pre-prostatic part, second prostatic part, and third membranous part. Okay, first of all, pre-prostatic part, which can be situated between the bladder and prostate. Okay, bladder and prostate, which is situated to pre-prostatic part. Second, prostatic part within the prostate. Okay, and the third, membranous part through perineal membrane. Next, features of the each part. Okay, first of all, we will see about the anterior urethral parts. Anterior urethral parts we will discuss about the previous slide. Okay, we will see the first two parts of there are there in the anterior urethra. First of all, bulbal urethra and penile urethra. So features of parts extend from the external urethral orifice. In that first, a bulbal urethra, it lies in the lies in the bulbosalpingeus. Okay, it widest part of the urethra. Bulbal urethra, it is the widest part of the urethra. Next, b penile urethra. Penile urethra, it is the lies in the corpus spongiosum. Okay, next, second, posterior urethra. So posterior urethra, we will see the three parts of the posterior urethra. So first of all, pre-prostatic part. Pre-prostatic part, in that 1 to 1.15 centimeter in length. Okay, next, extend vertically from bladder neck to prostate. It is the pre-prostatic part. And next, functions of the internal urethral sphincter. Okay, in that first, to maintain the urinary continence and prevent the retrograde flow of the semen ejaculation into the bladder. So this is all about the pre-prostatic part in posterior urethra. Okay, second part of the posterior urethra, it is the prostatic part. Okay, first, A 3 to 4 centimeter in length, and B, it is the pass through the substance of prostate. It is the pre-prostatic part. Third, membranous part. Membranous part, it is the shortest part, 1.5 centimeter in length, and next passes through the perineal membrane. Next, surrounded by the distal or external sphincters. It is all about the membranous part. It is the third part of the. Next, sphincters of the male urethra. Okay, it has about the two sphincters of the male urethra. Okay, mainly two sphincters are there. First of all, internal urethral sphincters, and second, external urethral sphincters. Internal urethral sphincters, it is the involuntarily. Okay, and next, surround internal urethral orifice and prostatic urethra. Okay, next, external urethral sphincter, it is the voluntarily and surround the membrane of the urethra. Okay, it is the external urethral sphincter. Okay, it is all about the male urethra. It has the two sphincters, internal and external urethral sphincters. Next, female urethra. Okay, female urethra, it is the 4 centimeter length and 6 mm in width. Okay, next, it begins from internal urethral orifice and passes downward and forward. Okay, next, opens in the vestibule between the clitoris and vaginal orifice. Okay, next, sphincters of the female urethra. It has also the internal and external urethral sphincters are there in the female urethra. Okay, next, glands around the female urethra. The glands open in the female urethra. There are the mainly three glands. First of all, urethral glands. Second, paraurethral glands, and third, greater vestibular glands. Okay, first it is the urethral gland. So it is a formation of the mucus gland. Okay, mucus gland, also known as the urethral gland. Okay, next, paraurethral gland. It is the correspond to the prostate. It is the paraurethral gland. And third, greater vestibular gland. Next, epithelium of the urethra. Epithelium of the urethra. Next, in that transitional epithelium, it has mainly three epithelial layer of the urethra. A transitional epithelium, next, stratified and pseudostratified columnar, and next, third, stratified squamous epithelium. Okay, first, transitional epithelium at the proximal end, which is situated in the transitional epithelium. It is the near the bladder. Okay, it is the situation situated in the near the bladder. It is the transitional epithelium. Next, stratified and pseudostratified columnar, in the situated in the mid urethra, in the which we can see in the male, stratified and pseudostratified columnar. Next, stratified squamous epithelium at the distal end. Okay, it is the present in the distal end near the urethral opening, which is situated in the the urethral opening, stratified squamous epithelium. Okay, this is all about the epithelium of the urethra. Okay, next resources used to the this topic about this topic urethra. First of all, Rosal Winsel Anatomy Physiology, and second this www.slidesets.net. Okay. Thank you.